And good afternoon, everyone. So the session is how do we build trust in science after COVID? And so for those of you who are outside of healthcare, please stay with us because this is a conversation about reputation, and it's something that impacted every single person on the earth, every single company, and it continues to impact life today, as Paul has said. So it's about institutions, it's about media, and so we have a lot to discuss. So we're getting to be more intimate here, so if people have questions while we're talking, raise your hand. Let's join into the conversation. We're at the end of the day, and it's been a rich 2 days together. So I'm Sherry Podlosky. I'm Group President of Corporate Affairs at Real Chemistry. For those of you who may not know Real Chemistry, we're all healthcare. Our mission is to make healthcare better through communications. And so we want to do that through our AI-powered insights. We do it through our deep expertise. Many of us have worked in healthcare for many decades. And we want to bring forward client-centric, patient-centric, people-centric ideas. So I'm very fortunate to be joined here today with two fabulous colleagues. Gulden Massera, here on my far left, is a founding partner with M&D Advisors. It's a boutique advisory specializing in public affairs, communications, and reputation management. Gulden is an award-winning C-suite executive, board member, and change agent. She's had senior roles at Pfizer, so the two of us got to work together for almost a decade at Pfizer, which was fabulous. Abbott, AbbVie, Walgreens Boots Alliance. Welcome, Gulden.
Thank you.
Thank you for joining me. And next to me is Erin O'Malley. She's got the real cred. She's the Executive Director of Coalition of Trust in Health and Science. So she deals with this topic. She just told me it's not 24/7, it's 26/7, right? So she's thinking about it all the time. This is a dynamic coalition of 90 leading healthcare and scientific organizations. And interestingly, it was formed in 2023. So this is pretty far into the pandemic, and we still saw this need because we saw the trust erosion. So Erin has made her career as a healthcare advocate, and one of her greatest achievements was securing $15 billion, that's B with a B, for funding for COVID relief for safety net hospitals. So thank you for joining. Appreciate it. So over the next 45 minutes, we're going to delve into a crisis that faced the healthcare industry and all industries, and the massive impact of mis and disinformation on global health. So if you just pretty much open your phone each day, you'll see some mis and disinformation, and some of it's coming from some really trusted sources. So it really is a time for us to talk about how we need to depoliticize health. Health is good for people. It doesn't have a political agenda, but it does many times in our own lives today. And so for purposes of this conversation, we had this in our preparation, we were talking about mis and disinformation is even politicized, and so maybe we need to call it misleading or inaccurate or unverified information. So we have a neutral conversation about something that it can be quite harmful. And so as we navigate these complexities post-pandemic, in the communications realm, we need to have some room and we as companies and as communicators in positions of authority, we have a deep responsibility to rebuild consumer confidence in scientific information. So I wanted to just talk to both of you and say, why is this a passion topic for you? Gulden, you've worked in every aspect of the healthcare ecosystem, every kind of provider organization, research organization. So talk to me about this lack of trust in science and why it's so important to you.
Oh boy, yeah, it's definitely an area of passion for me, and I've always had an interest in health and wellness and science, and for the past 3 decades of my life, I've spent 20 years working in pharma companies, and the last 10 years working for a pharmacy chain, if you can call Walgreens Boots Alliance that. as well as more recently as the Chief Marketing and Communications Officer of City of Hope, which is a national health system that's focused only on cancer. And quite frankly, as I went from one aspect of the health system to another, one of the things that surprised me the most is how disconnected things are, even from the inside. Sometimes we see that as healthcare consumers from the outside, but when you're in these companies, they're all very well intentioned, and some of us work with them or for them, but even patient journeys from the lens of a pharma company to the lens of a pharmacy to the lens of a health system is very different. And for what happened to me personally is my personal view on the system evolved. My views as a communications professional and as a business professional definitely changed the closer I got to patients, which was in my last job in a health system. But the other really interesting thing that I saw was in one conversation, I'll share an anecdote with you about my conversation with a doctor in a health system. I had just joined and I spent all this career in healthcare, and I was telling him about my career in healthcare, and he said, no, you worked in pharmaceutical and pharmacy. This is healthcare. And I think that's very telling, just around some of the perceptional silos that could sometimes lead to partnership opportunities not happening or failing or not even being thought about across the ecosystem, which again for me was very interesting to see.
You know, it's so important that we always go back to, we always talk about who is our customer, who is the target audience, who are we trying to reach, and taking their perspective first, because that's what matters, and we always tend to be looking at our own, so absolutely. So Erin, you do this 26/7. So tell us what started this coalition, and you're passionate.
Wonderful. Thank you, Sherry. It's great to be here with you, Golden, and this audience. And I want to pause and say thank you to Real Chemistry. You guys were one of our early coalition members. You've been a thought partner for the last 2 years, giving us pro bono insights. And so greatly appreciate the contributions of Real Chemistry. So yes, this is a role that feels a lot like 26/7, 29/8. It is all-encompassing. So I spent 20 years in DC doing healthcare policy work from various perspectives, leading coalitions, driving a CDC public health campaign. My most recent role, as noted, was representing safety net hospitals. So those hospitals who serve the underserved in our communities, uninsured patients, immigrant patients, et cetera. There are deep issues, historical issues, thinking back to the Tuskegee Project that have driven many people from trusting the healthcare system. Fast forward to COVID, I distinctly remember the moment that the mask mandate recommendation changed. And I thought, good, the science is working. They're doing research, we're learning more, we are going to be safer, we're going to come out of this. That was also a pivot point for many Americans to say, you got it wrong from day one, I can never trust you again. So our coalition was formed, as noted, back in 2023 by a series of luminaries in healthcare who figured we need to do better. We need to work together, not just to rebuild trust, but to collectively be trustworthy. And so with the backing of almost 100 national organizations, we have what in DC we'd call a group of strange bedfellows, organizations who had never come to the table. Golden, when you talked about, no, you don't work in healthcare, you work in pharmacy, that is a mindset of many people. But we, for the first time through our coalition, were able to bring together the entirety of the healthcare ecosystem through the trade associations, foundations, societies, nonprofits that represent healthcare, that lead and have voices like Real Chemistry in healthcare. And I'm excited to tell you about how we work and the challenges that I am facing on that 26/7 workday.
Thank you for joining us. So let's talk about first the trust gap. I mean, we always want to jump to the solutions, but it's good to always marinate in the problem. And so, Golden, from your perspective, just in your observations, and I think you were in the pharmacy at this point during the pandemic and in the healthcare provider space, what ways did COVID-19 pandemic influence trust and trust in science and in healthcare?
How much time do we have again?
That's right.
It's, when I started thinking about this, let's just like take a step back and like go back to 2019, 2020. It seems so long ago, but we all went through it together. It was such a crazy time. You talked about the mask mandate, right? So first we heard about this virus. Then nobody really knew where it was coming from, if it was going to come into our communities, our countries. Then there was all this information about, okay, you don't need to mask. Then it was, no, you do need to mask. Then the rules changed again, 6 feet separation, and then it was, no, you can take off the mask if you're eating. And then there was no treatments available. Then there were treatments available really fast, and the speed of lightning, and virus, anti-vaccines like being produced faster than they've ever been produced before. And schools were closed, work was closed. We all started to find new ways of really reaching out to people about our health questions. Telehealth became a really big thing. Wearables, friends and family, influencers sharing their personal stories online, all of that really exploded. We all went through that together. And in the beginning, I personally was very excited because health and science was front page news in the way that, oh my God, what's going to come out next? The research, the scientists. But that quickly pivoted to too much information, misinformation, guidance being changed by authorities in this country and in other countries as well. And that led to what we're talking about now, this continuum of distrust. What do I trust? Who do I trust? And I was reading most recently from our colleagues at Edelman, the fantastic, and if you haven't read this, I sincerely recommend it. I know if anyone from Edelman is in the room. But aside from the trust barometer, they did a special report on trust in health, and this is recent. Friends and family are more trusted than scientists and health experts for health information. 53% of respondents expressed distrust in institutions addressing their health needs, and a majority believes societal leaders mislead the public on health matters. Mm-hmm. So all of this that we're experiencing now, the distrust, stems from the experiences that all of us went through together globally, starting with COVID.
Thank you for taking us through that, because you kind of have tried to forget. At least I have forgotten pieces of that. So, Erin, how has the landscape evolved, and what do you think are the greatest challenges and gaps we have right now?
Oh, we have a lot of gaps and challenges, and I think one really unique angle of COVID is the fact that it brought the government into people's lives in a really palpable way, in a way that, sure, you go to the DMV and you probably don't like it, but you're not really thinking about it as government overreach, government telling you what to do. In theory, we all comply with laws, hopefully every day, but it doesn't feel palpable. For the first time, we had, in particular, public health at the federal, state, and local level getting involved in life, saying that our values in public health of ensuring that we keep people healthy, that we preserve human life, outweigh that of keeping your business open, of sending your kids to school, of think about any of the things you couldn't do in the context of COVID. And that headbutting existed, and again, in ways that we've never really seen it before as a nation, and it continues today. You bring up the Edelman report, which is a fabulous one. You can turn to Pew, you can turn to Gallup. What we are seeing today is that regardless of the sector that you're in, trust is eroded. What's so unique about our field of health and science is that, and no disrespect to any other fields, including those who've been represented on the stage today, having good health, making good decisions is economically smart for families, it's economically smart for the nation and our productivity, and it's good for our democracy. And unlike so many other sectors, science evolves. Science is based on curiosity. Science is based on failures. We have scientific innovation today because of failures from yesterday, and most people don't understand that. And so, when we think about trust, I am happy to see that in that compressed landscape, trust with your physician, your nurse, your local pharmacist, depending on the survey, your local public health official or scientists, it exists and it's highest among all the other sectors, but again, it's still so low right now. And so part of what we're trying to do is recognize that this is an absolutely long game. It's also worth noting that trust is very fluid. I often take the example of vaccines. People say, vaccines are kind of the canary in the coal mine, or the gateway. If you don't believe in vaccines, you're probably not going to believe in the science behind it. You're probably not going to believe in public health. And when you think about science and how much we trust science, it feels so far from our daily lives, especially when science can evolve. We talked about the evolution of mask mandates. Science is never perfect, it's never linear. And the final thing I'll say about this is, as we communicate science, it's very hard for our field, that of public health officials, scientists, and doctors, and medical professionals, to lean into ambiguity, which was something we absolutely had to do during COVID, and some could say probably didn't get it right. Because of the evolving nature of science, it can be very hard to communicate effectively, leaning into both the curiosity that brings scientists to the table, the ambiguity of the evolving nature of science, and the need to help the average member of a country, an average citizen, understand what innovation means to them.
Thank you. I mean, it's also difficult too when the average citizen is continually getting validation of certain beliefs because of the technology they're using as their news sources. So I think the polarization of science is very dangerous, because health is good for everyone. And we need to be looking at ways that we can help to raise awareness of sources that are trusted, raise awareness of authorities, allow people to make decisions with appropriate information. And that's an important responsibility that we have as communicators. So let's talk a little bit about how we do that and how we can combat misleading information. And we've spent a lot of time talking about AI at this conference. And I was speaking with Mr. Holmes out in the lobby, and we were just talking about, well, now it's okay to say if it's something you don't like, that was just AI. And it might have been a very valid source. So it's a confusing time for people. So Erin, talk to me about what the coalition does to help help to ground organizations in how to make sure their stories are being told.
Sure. So I have a lot of ideas on this, and I'm going to take a step back to 2023, 2024, when I stepped in as the inaugural executive director of the organization. A wildly different period of time, even though it wasn't that long ago. So when we were formed, we really thought that we would have the backing and the weight of 100 national, credible, expert organizations, and that we would be the arbiter of all things truth and trust. We would be out, we'd be combating misinformation, people would trust us. Insert laugh here. It doesn't work that way at all, especially today. And so where we have focused our efforts in recent years is, one, and I would love the feedback of this room in particular, we recognize that, one, this is a long game, and two, we are best behind the scenes, activating on two distinct platforms. So one is recognizing that when you look at our membership, we have the reach of upwards of 200 million individuals who are professionals in the field today, whether they are at a lab bench doing biomedical research, out in a community as a public health official, or providing care at a patient bedside. So we are working through our members to reach those professionals with information on how do you engage with skeptical individuals who've already been absorbing or buy into misinformation? How do you stay on top of trends related to misinformation? How do you communicate with empathy that is a building block of being trustworthy? So a lot of our effort is behind the scenes, helping our members, help professionals in the field. A second component of our work, in that big tent of ours, we do have patient and consumer organizations, and we've been doing education to help the American people understand why making evidence-based health decisions is so critical. Unlike any other decision you make, whether it's, am I going to buy an electric car versus a hybrid? Am I going to buy this brand of tennis shoes versus those? evidence-based health decisions are so imperative for the good of the nation and, of course, down to the individual. And so a lot of our work has been focused on what you'd call media literacy, science literacy, data literacy, but with a focus on mis or disinformation. I'm not actively combating or playing whack-a-mole with misinformation as it pops up, but helping people understand what happens when they interact with misinformation. A hallmark of mis or disinformation is that it elicits an emotional response. If you read something on Twitter, or you see it on TikTok, or better yet, and this is often forgot about in the context of misinformation, if we're out to dinner tonight and I say falsehoods to you, you're going to need those tools to recognize, oh, Erin has no idea what she's talking about here. I'm going to get curious. So again, the hallmarks of misinformation, if you hear something, read something, and you get angry, you get curious, you laugh, you get furious or fearful, that is a sign I need to go back in and do some more research on this topic. The final thing I will say, well, two additional thoughts for you. So because we are not actively on social media combating misinformation and letting our members do that, we have an infrastructure for the real-time exchange of facts for our members. So we're constantly feeding them. If fluoride's the hot topic in the news today, here are the things you need to be saying that are accurate about fluoride. Final point on my behalf here is really thinking about the playbook. As I noted earlier, the model that we started with only a few years ago in 2023 is obsolete. It's just off the table. You know, I can't tell you how many people come to me on a daily basis and say, we have a public health crisis. What do you think about getting this former government official or this very well-known virologist on CNN tonight? It's not going to do anything. I have members who say to me, I've moved off of X because I don't believe in what they're doing, but I'm on Blue Sky and people love my public health message on Blue Sky.
No one else is there.
Nobody else is there.
Right.
And think of all the important public health messages that people not on Blue Sky are missing out on. And so would love to dive into this whole idea of what does the new playbook look like?
So absolutely. I mean, the playbook is just a lot of what we had been talking about, which is if you're not looking at how you're showing up in AI search, you're not knowing what's going out there about your company, about your products, about your science. So that needs to be something that's really proactively done in addition to the old social listening, but making sure you're doing image-based social listening because a lot of this is coming through, 90% of the content's coming through in pictures. So, and we need to make sure that we're at the forefront of doing that. I wanted to ask you a question about your model and your work and your studies about influencing people. So one study that I read said that if you correct a misperception, then you actually have someone learn even more deeply than they would have if they had heard the information directly. Is that right?
I have read that. I've read that falsehoods on Twitter, or X in particular, move 7 times faster than fact. There are many data points that are coming together. The science of understanding this space is coming together. Early on in our tenure, one of our board members out of the UPenn School of Nursing tapped several postdocs to look into, from a scientific perspective, what do we know? I know the myth-fact model came up on one of the previous panels. That is a no-no. Like, people keep in their mind the myth, doesn't matter how convincing the fact. And so these create very nuanced challenges for us, in addition to the fact that people go in many different directions to get their information. We have such a bifurcated media and information ecosystem now that even if we can combat something like misinformation spreading 7 times faster on X than fact, we still have to worry about the psychology here. We still have to worry about how do we clean up messes effectively as a brand or as a field. So I'm very much aware of that and some of the other emerging statistics in this space.
Thank you. So let's talk about adapting to these evolving expectations and new perceptions and realities of what we have to deal with. So amidst the uncertainty and skepticism, the one constant is that healthcare consumer expectations are always evolving. That's pretty, everything is always evolving. So Goulden, what are some innovative strategies or tools that have proven effective in healthcare companies when adapting to evolving expectations?
So first of all, Erin, congratulations for all the work you guys are doing in the coalition. It is so incredibly important. And Sherry, I also agree with Erin in that the playbook has completely changed. The comms playbook and the marketing playbook has completely changed. And I think at the fundamental center of that is the fact that healthcare is so incredibly personal, and you are healthy until you become a patient, and all of us become patients. All of us are caregivers or caretakers, and there is always a time when you're going to find yourself, either for you or with a loved one, in a pharmacy or in a hospital setting to try to get care, and then figuring out how to pay for it, right? And add to that the amount of, we talked about COVID and what that led to from a communications lens. It led to this explosion of new channels and podcasts, and Instagram was there, but TikTok exploded, and it's just, good luck figuring your way out of it. It's a lot. And then, of course, influencers either sharing their personal stories, which might be fact or science-based or not, right? And a lot of people trusting that because it's a person like me that I'm hearing from. So, when you look at the playbook, it's incredibly important to understand where the people you're trying to reach are going to get their information. For example, my 85-year-old mother, who has a number of issues, she goes to Instagram. My 19-year-old daughter, she gets all her information from TikTok. I'm still old school. I'll still read the news. I'll still go to the Times, Journal, CNN. I'll listen to my few podcasts. But even in my own tiny little ecosystem of family, I can see how we're being inundated by different sources of information, and that drives what you believe and what you do. But at the end of it, as healthcare consumers, we all want to know which sources to trust for information, know what to do with that, and pay for it, figure out how to pay for it, which is, by the way, a really big issue. Both access and affordability is a very big issue, both in this country and in other countries, right? And one of the important things is, in the past, I could have talked about a playbook where we would do mass communications campaigns, right? You would have your spokesperson, and you would get some real nice top-tier coverage, and you would have some cool campaign, and you'd be happy because you were getting impressions. But when you think about what really moves the needle, what really gets someone into the right doctor's office to get the right treatment, or to do the thing that's actually going to help them, you need to really meet people where they are. Mm-hmm. And part of it is influencers. It's really important to engage influencers. It's really important to educate influencers that matter to, a Gen Z who was, digital first, and that's where they first go for their healthcare information. Or it's really important to be on different podcasts if that's what people are listening to. So looking at the playbook really differently, I think that it's a model that we haven't always used traditionally in healthcare comms, and I think in pockets we're doing it really well. But I can't talk to one singular example where it's a wow, but the last thing I'll say is organizations like American Cancer Society that are acting more and more as places where they can actually bring all the information together. Like ACS has a platform called ACS Cares. You go in and you could literally find out everything you need to know if you just heard the words you had cancer, right? Which is a life-changing moment. Being able to tap into partnership with those kinds of resources for information sharing, I think, is also increasingly important.
Absolutely, and I go back to the theme of this conference, which is about relationships, and it gets down to the stakeholders and understanding each of the individual audience's relationships and how they'll receive information, and then using multi-channel to get to it. When you said you haven't seen a great example, I think we were lucky in the awards to see some really fine examples of behavior change here, where you could track the insight all the way to the perception change or the action change. So in particular, the KPN example, which is a piece of me, we were taking a behavior, changing the perception of the behavior of sexting in teens to being acceptable, and turning the unacceptable piece around missharing information freely, and the impact that that was having on people's mental health, on their trust, on their ability to continue, and finding the right messengers to have that conversation changed the law. It changed perceptions, it's changed education, it's changed people's lives who now have a different reframing. And so really, really powerful. I'd also just wanted to say kudos to the She Runs campaign. I mean, just an incredible way to use influence and people's day-to-day lives to be able to pass along critical information, to share and save a woman from a violent situation, and having women be credible sources to each other. And like, absolutely, 0 men received this information. There was 0 media coverage of this information. Really, really powerful. So if you get into the insight, you can really have an impact. So I would like to just ask the question here, Erin. So do you have examples of successful campaigns that you've seen that you wanted to highlight, or just some of the successful practices?
Sure, I'd love to talk about practices in particular. So when you think of your average patient and you think of a pie chart of their average year and how they spend their time, even if that patient is what we'd call a frequent flyer, somebody who's always engaged with the healthcare system, they're only engaged with the system for a small fraction of the total time. And it is the rest of the year when they have questions about health or science or public health, and they're not in your office, or they're not engaged with the system, they're going elsewhere. And so one of the things we talk a lot about with our members, which is an element, I think, of the new playbook, is the fact that our field is not designed to meet the volume or the velocity of what the other side is putting out. We are wedded to the data. Data syncs on various platforms. Nobody, people's eyes glaze over. They're not interested in hearing exactly why this cooking oil is only okay here but not okay there, when they're met with a really intriguing short video with lots of very information, relatable content, etc. Our field is worried about liability. When they put out a video on TikTok, they're then worried, did I get this right? Is the science evolving tomorrow? We are just not meant for this moment, at least in terms of when we think of the other side, who is not wedded to the purity of the science, the data, the liability issues, etc. Another very important component, I think, of the new playbook is figuring out who the trusted messengers are. And the reality is, it is not those, especially when you think back to COVID, it is not those that are the experts in the room. Again, they're not trained to be the public face, and they, in many respects, have had their moment. It's very hard to say this when I'm speaking about my members, speaking about people who I really appreciate. I really can't underscore how much I trust the experts, the virologists, the former researchers who led us out of COVID. The American people aren't listening to them. And so finding the right trusted messenger, I have a lot of debates about how do our members hand off their messages to influencers. It sounds really easy. Find the perfect influencer and we'll get the message across. But again, for our side, we're worried about they might carry the message on psoriasis, but then in their next tweet or video, it's spewing misinformation. Can I really be associated with somebody who can carry my message and fail on another one? So the dynamics of this new playbook and getting comfortable with an ability to fill the space, meet people where they are in uncomfortable places. Again, going on Blue Sky and getting a lot of likes is very different than going on Truth Social and saying you need to be vaccinated and taking the hits and the punches. And so I feel very fortunate that our leadership within the coalition sees this new landscape, that we are pushing our members to try to think through, handing off their messages, finding people where they are. But it is a real culture change for our field and will take, I think, unfortunately, a lot of time.
Well, thank you. lots to facilitate. I always say in healthcare, we always have job security because we always have a crisis to address. And just some of the most important work in terms of what is important to humans. So I'd like to open it up to all of you. Any questions?
My question's a little touchy. How can healthcare communicators combat people of higher power, maybe like our current president, when he suggested to inject bleach as like a pro tip against COVID, things like that? When we should be trusting our government officials, how do you combat that as a healthcare communicator?
What is the Edelman statistic on trust of those people? I think it's very important that we provide multiple resources and the right resources to provide information. So I would say back to you, as if there is, it's being on the front end of finding misinformation, being transparent about the sources that you are bringing together and finding the credible voices to address those kinds of statements. You have a formula that you help your teams with?
I'm not sure it's a formula per se, but one of the trainings that we focused on is how do we help professionals in the field receive these points of information. You know, we're talking about relationships here. A physician with a long-standing relationship with a patient comes in and says the most outrageous thing, whether it's a reciting of injecting yourself with bleach, etc. How does the provider receive that information, not go into, what are you, crazy, not have an emotional or nonverbal response of rolling eyes or getting fatigued by the content. So there are ways that providers can and should be receiving such feedback from the individuals they relate to and respond to in ways that are ones to build trust. And again, one of the reasons why our coalition is not out there every day countering every falsehood, especially from on high within the administration, is we recognize that's actually not part of our playbook for rebuilding trust in healthcare. People who might hear such things and think, well, my president said to do it, maybe I should. Or my president said I shouldn't take Tylenol, maybe I won't. I still need to have trust, and we in the field need to have trust with that person. And by throwing bombs, by calling them false or wrong or crazy, we are further driving the wedge and further distancing the field from a trustworthy engagement. So it's really hard to do. I always think of this one pediatrician in the back of my head who said, I get the vaccine stuff. I'm ready. I'll be in clinic for 8 hours. I know somebody's going to come in with anti-vaccine rhetoric of some stripe. It's the, I'm going to inject myself with bleach. It's the grapes cause cancer. It's these really wild things that might not even be trending or tracking yet on social media that we have to get our professionals prepared for and be able to engage with.
This has been a really great panel, and I think one of the things as a healthcare communicator that I've been taking inspiration from the sessions today is kind of what communicators need to bring as a headset to where we are today. And a lot of what we've been talking about in the world of healthcare is correcting information that gets out, and we have to kind of find ways to bring that back. But I'm curious, as we look at on our front foot as communicators in the world of healthcare right now, what advice do you have as people who are helping to lead change in these dialogues and conversations? What should we be bringing as communicators to our partners, clients, team members, et cetera, for how they think about the role of healthcare communications?
So, and I think this is something that Real Chemistry and other experts in the space of healthcare do really, really well. First and foremost, I think what we're talking about, and you asked a really excellent question, for everything that I fundamentally believe in, there is someone who believes something fundamentally completely different. And it's very easy to say that's ridiculous and not listen, but spending the time to really understand where that dissent is coming from. Oh, I heard the president say, oh, I went to wherever and I heard this. Really understanding that and then being able to find a way to address that is incredibly important. And part of that is not even through, I mean, we talked a lot about like news and AI and channels, but at the human level, we're all in communities. The role of faith-based leaders is incredibly important. The role of schools is incredibly important. The role of hospitals, and not just doctors, but also nurses is incredibly important. So approaching the whole ecosystem, but also really making space to listen. Duke University has this really cool project called the Dialogue Project. I don't know if anyone's heard about it, but this is all about, understanding where the other comes from, and there's always another. And for the other, I'm the other, right? And so how pissed off am I when someone doesn't believe in what I believe in? Well, it's the reciprocation of that and really understanding that I think is really fundamental.
And then finding the trusted voices who can address each of the different stakeholders. I mean, I think that that's one of the key lessons in what you're talking about is like find the influencer, pass the information to. That's why we talk about AI as the age of the influencer in many ways.
My first part is if you could elaborate more on the data and science literacy tools you're using with the Tylenol stuff. I know you kind of briefly mentioned it. And then my second question was, has your team considered creating a health AI agent that only pulls from like journals and studies? Because if people are starting to trust AI more and more, maybe having something that's only research-based available, and that way when people are like looking things up, like blah, 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 AI, health-related, they're getting correct information that they're trusting because it is AI.
That's a fabulous question. I'm going to go in reverse. So there are some organizations who are thinking about doing that, along with credentialing potentially, so that influencers could have a seal of approval, if you will, that they have used evidence-based practices. So many people are kind of emerging in that space. So you have something to look forward to there. In terms of how we've functioned, almost all of the content that I work on is as evergreen as possible. You could insert Tylenol the way you could insert grapes cause cancer or injecting bleach. Again, I feel really strongly that it's the tools of response, not the exact language of the response, especially for something as big and broad as like injecting bleach. Like that's just a clear no. What we have done with those evergreen content is a toolkit. We did a town hall that got hundreds of thousands of views, which was fabulous. For our members, we have done a few different educational elements and workshops and functions. So when we knew that there was going to be an HHS report on the causes of autism, created in a very short amount of time. We got our members, the Autism Society of America and Dr. Jess Steyer from Unbiased Science, to come on and do a pre-bunking webinar for our members. Again, we knew this was going to be an issue in the news. We provided them with 5 core steps of how to take proactive efforts to communicate what we know about the causes of autism rather than just cleaning up whatever came out of that HHS report. And that's kind of a model that we use if and when there is a public health issue or science issue, health issue emerging, that we know our members can actually have some pre-educational communications efforts to lay the groundwork to actually get out of the mess before we get into it.
But anyway, I just wanted to see, are there any more questions? Or one last one? Thank you.
So there's like lots of issues. I feel like I, hear things from friends and family members or see things on social media all the time that are so different. How do you guys approach the uniqueness of each situation, and how do you combat the differences between, one campaign versus another approach when combating all these different issues that are out there?
I'm happy to take this first. So again, I think it goes back to the evergreen tools that are not unique to fluoride's good or bad or inject bleach or don't. It is the foundations of effective communication. So that to me is, again, why I think going the evergreen route, especially for educational focuses, makes more sense than the here are the list of talking points that you have to read verbatim on a given issue.
And also, just to add to that, if it is something like inject bleach, and the answer is like clearly no, being clear about that. I mean, there are areas where you do have to listen and understand and educate and bring an expert, and there are areas where it's just like somebody has to just go in and say like, no, this is not the right thing to do.
Well, thank you all for your attention. This has been a really rich conversation. Thank you, Golden, and thank you, Erin. I think just a few takeaways for all of us. We need to use AI and insights to be a step ahead. We need to not forget about quick response, transparency, and preparedness. We need to approach this conversation with empathy and compassion and respect, because we all need to be received in that way to be even able to comprehend what's coming at us. And we need to bring in the voices of credibility for the audience we're trying to reach. So thanks so much. It's been a wonderful day, and thank you, Paul, and the Provoke team for putting on such a rich conference. Take care.
Thank you. Thank you.